Good morning, everyone. Welcome to the public launch of the new Stem Cell Transplantation and Cellular Therapies Unit at the Juravinski Hospital and Cancer Center. For those of you who may not know me, I'm Dr. Ralph Meyer, and I'm the Vice President of Oncology and Palliative Care at Hamilton Health Sciences and the Juravinski Cancer Center, and Regional Vice President for Cancer Care Ontario. Today, I'm also proud and privileged to be a hematologist. Before we start our program, I would like to begin by sharing Hamilton Health Sciences' land statement. This statement was developed through extensive engagement with Indigenous leaders and community members and is part of our ongoing commitment towards making HHS a place that is welcoming and a place to receive respectful and equitable care. We are privileged to provide care on the lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of the land. This respect has been included in the planning of our new unit, including the unit's color scheme and 2 paintings that will be on display in the consultation rooms. In the Indigenous culture, these unit colors and the artist interpretations of her paintings represent Mother Earth and Father Sky and Grandmother Moon. Next slide, please. We're at an exciting time in our hospital's history with the opening of this new unit. I'm pleased to be here today with several presenters who have played important roles in its development. Each of these presenters will speak today to an important aspect of how we arrived here today, and I want to thank all for joining us today. There are special guests I would like to recognize and welcome. First, Member of Provincial Parliament, Donna Skelly, is representing the Government of Ontario, and we appreciate the support that the Government of Ontario, the Ministry of Health, and Cancer Care Ontario have provided in getting us to where we are today. Secondly, I want to welcome Frances Hillier, whose daughter Laura received care at the Juravinski Hospital and Cancer Center. Laura, Frances, and Laura's dad, Greg, have had an important role in galvanizing processes that have improved access to stem cell transplantation across Ontario. Frances, we're honored and privileged that you are joining us today. Thank you. Next slide, please. At Hamilton Health Sciences, we have a rich history associated with providing care and treatments to patients with blood cancers. With this new capacity, HHS staff and physicians will be able to continue to build on more than 50 years of pioneering treatment and research in this specialty area of care. In this context, I would like to acknowledge the historic contributions of some people who helped lay the foundation for where we are today. I'm happy to say that some have joined us for our celebration today. As I show the slides for these individuals, please note the reflections that these important contributors have passed along for us. Next slide, please. Dr. Ted Wilson was the first full-time hematologist to begin practice in Hamilton. He was responsible for introducing chemotherapy to our community and for training multiple generations of hematologists. Ted and his wife Pat reside in Ancaster and were to join us today. Dr. Michael Brain came to Hamilton from England in 1969 and was the first division director for hematology in what was then the new McMaster University Medical School. Mike and his colleague, Dr. Irwin Walker, were responsible for initiating the allogeneic stem cell transplantation program at Shadok McMaster Hospital in 1981. Irwin continues to provide care and lead transplantation research at HHS and has been an extraordinary mentor for many physicians and staff. Ted and Mike provided exceptional leadership in creating a foundation upon which our current program rests. There are now 14 hematologists at HHS who are dedicated to the care of patients with blood cancers. Two other hematologists each had foundational roles in our history and have recently retired. Dr. Ann Benger began her role at the Henderson Hospital in 1982 and was responsible for developing the autologous stem cell transplantation program. Dr. Deb Marcellus did her training here and then worked in transplantation at Johns Hopkins University before returning here in 1999 to have an integral role in advancing our program and leading in the teaching of our students. The program also has a storied history in nursing. In 1997, Jane Garner became the first acute care nurse practitioner in hematology and was based at the Henderson Hospital. Jane modeled this important role, which has now grown to include 12 nurse practitioners in the hematology program. Kathy Greene began her role in hematology as a ward nurse in 1981. She later became an allogeneic stem cell transplant coordinator and modeled this role, leading to its integral functions today. With expansion, the program now includes 10 transplantation coordinators. Finally, the stem cell transplantation and cellular therapies program require very specialized laboratory skills. Pam Ohosky was a specialist in transfusion medicine and the laboratory supports needed by the stem cell transplantation program. Pam was responsible for overseeing the development and implementation of many laboratory processes, including those required to comply with regulatory authorities. Today, there are more than 75 people working in our laboratories that have some role in supporting the stem cell transplantation and cellular therapies program. To each of these individuals and to many others, thank you for helping to grow the program to what it is today and for the care you provided for so many patients over the years. This unit is a testament to your unwavering dedication. This work builds on Hamilton Health Sciences' substantial expertise in the field of blood cancers, the treatment and cellular therapies, and creates new capacity to support additional research and advances in the malignant hematology program of our hospital. It's tremendous news for patients in Ontario. As home to one of Ontario's 3 full-service adult stem cell transplantation program, we will serve patients from our region, as well as from Mississauga, Halton, Waterloo-Wellington, and Windsor. In addition to providing care for these patients and their families, we'll be expanding our important roles in teaching and in research. We would not be celebrating today were it not for the role of the Hamilton Health Sciences Foundation and the many donors who have made it possible for our clinicians to continue to provide leading-edge treatment. I'd now like to turn it over to Pearl Venema, Chief Executive Officer of Hamilton Health Sciences Foundation, to provide a few words. Pearl?
Good morning, everyone. Thank you, Ralph. We so wish we could be meeting in person to celebrate such a momentous occasion. We are so proud of the $5 million that we raised through Tomorrow Stems From You. This represents the community share to enable this capital expansion and purchase equipment and furnishings. This was essential to complement the $25 million provided through the Ministry of Health. And while the campaign to raise the initial $5 million is complete, we are continuing to raise funds through Tomorrow Stems From You. We want to enable the hematology program so that it can continue to meet growing patient needs. As many of you know, this ongoing fundraising is essential as the government doesn't fund the purchase of additional equipment and patient amenities. We will also continue to support ongoing research, education, and clinical trials. Before I proceed in thanking many of the people who have helped us get to this point, it is my pleasure to introduce a short video unveiling the naming of the new unit. 1, 2, 3. It is truly my pleasure, as you have seen in the clip, to acknowledge Nancy Clark and the Clark family for their tremendous generosity. It is with pride that this wonderful new unit is named the Ron and Nancy Clark Stem Cell Transplantation and Cellular Therapies Unit. I would also like to acknowledge the estate administrators and friends of Tim Conroy, Anne and Rick Watkin, and Mike Casillo. Many of the physicians and staff in the hematology program and across JHCC supported this campaign, either directly or through various events. We appreciate your engagement and commitment to our work. Donations come in many different forms. This campaign benefited from donors who organized and hosted events, made personal donations, corporations who provided philanthropic gifts, as is evidenced from the gift from the Tim Conroy's estate, and others. Legacy gifts also played a role. We are grateful to each and every donor, and we are also appreciative of all of your efforts as clinical teams. The compassionate care you have provided inspired many of the donors represented on the donor wall through the named rooms and countless others who are not reflected in the formal recognition. To Kim Alvarado and all others involved in the planning, the building, and organizing of this new unit and the associated program expansion, this has been years in the making. Congratulations on continuing to enable the highest quality of patient care. I would also like to thank the foundation team who worked passionately on this campaign. For many on my team, this campaign became very personal, and they embraced it with heart and soul. Before I introduce Charles Cremonesi, I would like to acknowledge and thank the entire campaign cabinet, chaired by Charles. The cabinet included Dr. Kylie Lepik, Dr. Ralph Meyer, community members John Juris, Frank Razzo, Marita Zafiro, along with Rob McIsaac, Casey Carruthers, Tamara Pope, and myself. And now I would like to introduce Charles Cremonesi, who not only served as campaign chair for Tomorrow Stems From You, but is also board chair at Hamilton Health Sciences. Please welcome Charles Cremonesi.
Thank you, Pearl. It's a very special day today, and I'm very proud to be a part of this celebration. It's been a long journey from concept to the day of opening today. And I want to just tell you a little bit about my involvement in that journey. I've had 3 capacities, and Pearl has alluded to some of them. The first and foremost for me, and the most personal, is that my family has been touched by the stem cell transplant unit. 4 years ago this month, my late brother Vince had a stem cell transplant, a successful stem cell transplant. And that began my interest in transplantation. I know firsthand the quality of care that patients receive in this unit, and I'm very confident and happy that with this expansion that we will be able to save more lives and or extend people's lives. My second connection to this campaign is as chair of the campaign team. And this has been one of the great joys of my life, to work with passionate people for a common purpose and with a result like the result that we're celebrating today. It's been very gratifying for me, and I could not have done this without all the support of the members of the campaign team. In that capacity, I also want to thank all the donors who stepped up generously when we approached them and made this vision a reality. The third and final reason why I'm here celebrating is because I'm the chair of the board of Hamilton Health Sciences. And in that capacity, and with my board colleagues, we have gotten behind this project, supported it, both in terms of our decision making, and also I'm proud to say that all members of the board contributed financially also. So in those three capacities, and just before I conclude, I wish to thank all the physicians, all the staff, the provincial government, and everyone who has had anything to do with this project in the past or will serve our public and our patients in the future through the vehicle of this new unit. Congratulations to everyone, and thank you for having me here today.
Thank you, Charles. Your message and the personal nature of your message is so important to us, and we're very respectful of what you've been through, and for you to honor us today and the support you've provided throughout the campaign has been remarkable, and we're extraordinarily appreciative. Thank you. Pearl, I also want to thank you and Tamara Pope and all the other members of your team. Your support for the mission of what we want to advance in caring for patients is so well understood and so well supported. Thank you. I'd now like to introduce President and Chief Executive Officer of Hamilton Health Sciences, Rob McIsaac. Rob?
Thank you, Ralph, and good morning, everybody. What a proud day for Hamilton Health Sciences. You know, given all that's happened, it seems kind of like a lifetime ago that many of us gathered to be part of the government funding announcement of the stem cell unit expansion. But it's really just 18 months later that we are gathered again, albeit virtually, to mark the occasion of the construction being complete and the unit opening imminently. You know, it's been a lot of hard work and dedication by a lot of people to make this happen, to move from funding to construction to opening in less than a year and a half, and to do it all in the midst of, and maybe better said, in spite of a global pandemic. The new physical structure is due to the work of many hands, including architects, engineers, designers, and construction teams. Importantly, it has been shaped by the input and advice from staff, physicians, patients, and their families. And the groundbreaking treatments that happen here are, of course, due to the dedication of researchers and clinicians who make better care and better health possible for all of us. Projects like this also require real leadership and vision, and I'd like to thank Dr. Ralph Meyer and Pearl Venema and their teams for their drive and determination. I also have to acknowledge my board chair, Charles Cremonesi, who provided such great leadership as campaign chair for the initiative. Really grateful to you and the many generous donors you worked with for the financial contributions, which are enabling the lives of countless patients and their families to change. We know that at the heart of this work are patients, their families, and stem cell donors. Your courage, tenacity and endurance are an inspiration for all of us. Our partners in the provincial government have also been integral, to say the least, to the expansion of our stem cell unit. Without our government's participation and support, we wouldn't be having this special celebration. We have a very special guest today in MPP Donna Skelly, who represents Flamborough-Glanbrook at Queen's Park. Donna is a longtime friend of HHS, and particularly the Juravinski Hospital and Cancer Center, which was part of her municipal ward back when she served on City Council. Donna, we're really pleased you could join us again today, and on behalf of patients and families and everybody here at Hamilton Health Sciences, I want to thank you and the Ford government for your commitment to expanded access to stem cell treatment and care in Ontario. Donna, I'm going to turn it over to you. Not sure, Donna, if maybe you're on mute.
Can you hear me now?
Yeah,
And can you hear me now? How's that? Okay, I'll start again. Thanks, Rob. I am very, very pleased, and good morning, everyone, to be here this morning to represent the province of Ontario at the official opening of the Ron and Nancy Clark Stem Cell Transplantation and Cellular Therapy Unit. Our government's investment of $25 million to expand the stem cell transplantation unit at Juravinski Hospital and Cancer Center is wonderful news for the world-class medical team here at Juravinski, and of course for your patients. Juravinski Hospital and Cancer Center is one of the 3 hospitals in Ontario providing all forms of adult stem cell transplants. This new stem cell unit builds on Hamilton Health Sciences' substantial expertise in the field of blood cancer treatment. The investment will support a 15-bed inpatient unit for patients undergoing stem cell transplants and other complex malignant hematology cancer treatments. The 5 treatment bays will allow for the expansion of oncology day services. The unit will ensure that patients will receive care in the right place at the right time. The renovated pharmacy will support the growth of the expanded stem cell transplant program. The new facility will offer leading-edge cancer care. Hamilton Health Sciences and your gifted team of medical professionals is renowned for your work in life-saving cancer care and stem cell transplant. JHCC has established itself as a leader in all forms of stem cell transplantation. This new capacity will support further research and biotech advances in stem cell treatment. It will support the advancement of HHS's and McMaster's research strengths in blood cancers. The stem cell unit builds on the extraordinary history of cancer treatment in Hamilton. It allows more cancer patients to receive treatment closer to home. This investment builds on our government's commitment to reduce wait times for life-saving cancer treatments. This new unit will support thousands of patients from across Ontario who require stem cell transplants and other complex malignant hematology cancer treatments. Our government is committed to expanding stem cell transplants to meet the growing demand. The talented and dedicated team at JHCC should be so proud of your many achievements. Let me mention a couple of milestones. In July of last year, Dr. Brian Leber performed the 1,000th allogenic stem cell transplant. This number is evidence of the many patients who have been treated and cared for at JHCC over the past 3 decades. The teams at HHS have spearheaded several new advances that have become the standard of care in stem cell transplantation. Another example is Dr. Irwin Walker, who in 1988 performed the first successful Canadian transplant with a donor who was not related to the patient. The Hamilton patient was infused with stem cells that were collected from a donor in the United States. And as I understand it, this was a significant milestone in transplantation because up to that point, only a minority of patients who needed a transplant actually had a matched donor. As a result of that work, 80% of patients who need a stem cell transplant now can receive one. Juravinski Hospital and Cancer Center has continued its leadership role in the area of stem cell transplantation. Dr. Walker and his team headed the only Canadian trial on half-match donors. Because of that groundbreaking research, almost all patients can have suitable donors. Patients who were once considered too old to receive the procedure now have the option of undergoing a transplant. The dedicated medical teams here at Juravinski Cancer Care pioneered the mini transplant in Canada, which is now the standard of care for older or frail patients. JHCC has been recognized for the work that you've done on the use of stem cells in the remission of cancer. JHCC has been credited with conducting innovative clinical trials to test and develop new transplantation procedures. I understand that the need for stem cell transplants is greater than ever, and that's why this stem cell unit is so critical to cancer patients in Hamilton and surrounding regions. Your long-term relationships with your patients is a testament to the fact that you sincerely care about their welfare. Given that many of your patients have been coming to your annual picnics and Christmas parties, some for as long as 30 years, is further evidence of the life-saving work that you perform at Juravinski Cancer Care. The Ontario government's investment of $25 million has made the expansion of a dedicated and specialized clinical space and the purchase of essential equipment possible. As the stem cell transplant program continues to evolve with advances in medical science and technology, I commend the team here at Juravinski Hospital and Cancer Center for your accomplishments and dedication to improving the lives of people with cancer. And I look forward to the future milestones that you will certainly achieve. Thank you.
Thank you, Donna. It's a real honor to have you join us here today and to celebrate this important time. And your support and your recognition is very impressive of your understanding and recognition of many of the accomplishments we've had. It means a great deal to us. So thank you for joining us today. I'd now like to introduce our head of the Division of Hematology, Dr. Tom Karukas, who will speak about the significance of this new unit from a clinical perspective. Tom has a unique role. He also is Cancer Care Ontario's provincial lead for malignant hematologic cancers, and thus has a wealth of understanding of where our unit fits for our patients and where it fits in the provincial spectrum of activities. Tom?
Thank you, Ralph. Good afternoon, everybody. It's my pleasure to be with you this afternoon. So it's a great day to be here with the opening of our new hematology stem cell unit on B4. As you've heard, my role at Hamilton Health Sciences is as the division head for malignant hematology within the Department of Oncology and at the Juravinski Hospital and Cancer Center. As it also happens by fluke, I happen to be the provincial head for the program in complex malignant hematology at Cancer Care Ontario, which is now, of course, part of Ontario Health. The first thing I'd like to say is to acknowledge the hard work of our entire team in preparing for the new unit. It seems like it was a long time ago that we started this work. The foundation, in addition, their tireless fundraising efforts, very critical for this, and in particular, our very generous donors, without whom this would not have been possible. As you've heard already from Ralph and others, complex malignant hematology care in Ontario is a regionalized service, and it provides this complex care to patients with acute leukemia and to those patients who need allogeneic and autologous stem cell transplants, and more recently now to those needing CAR T-cell therapy. The goal of our provincial program is to provide the best expert care in the safest manner as close to home as possible for patients and their families. This treatment is very taxing, and thus, if we can provide it closer to home, it's much better. We all believe that irrespective of where people live in the province of Ontario, they need the same access to these innovative and groundbreaking treatments. The demand for these services is huge. In the past 10 years, We've seen the number of autologous transplants almost double from less than 400 per year to now over 700 per year. And for allogeneic transplants, similar numbers. They've also doubled from about 160 per year to now over 340 per year. This is due in part to the changing demographics of the general population, like the aging of the population is one example, better supportive care, more innovative care with newer treatments, and now, as you've heard, our ability to find and use more stem cell donors. We're now able to provide these treatments and transplants to more patients than ever in the past. These treatments have also become safer and therefore applicable to more patients as they get older. As you've also heard, we're in a unique position in Hamilton as our Juravinski Hospital is one of the 3 full-service centers in Ontario. When we had CAR T-cell therapy available earlier this year, we were only one of 2 centers in Canada providing the service to adults. We're very proud of that. The new unit on B4 will allow our highly trained clinical, laboratory, administrative, and other supportive care staff to further our mission to provide the best care to a growing population of patients who need allogeneic and autologous stem cell transplants, CAR T-cell therapy, and to those who need treatment for acute leukemia. The new unit will represent a significant increase in our capacity locally and provincially to meet the growing demand for these complex malignant hematology services. I would like again to personally and wholeheartedly thank our donors. We need modern and expensive equipment to enable our clinical teams to provide the best care. And without our generous donors and their fundraising, we would not be able to maximize the benefits to the patients and their families who will be using this new unit. On behalf of the clinical team at the Juravinski, thank you very much.
Thanks, Tom. That was a great summary. I'd now like to introduce Dr. Kylie Lepek, who is our Director of Stem Cell Transplantation and Cellular Therapies. Kylie's going to put the new unit in perspective in terms of the further opportunities for research and teaching and innovation that has been a long-standing part of our program. Kylie?
Thanks, Ralph. We're so excited for the opening of our new stem cell transplantation and cellular therapy unit. This new unit opening represents another chapter of hematology in Hamilton, as this program continues to grow since the first transplant was completed in 1981. As the current medical director of the program, I'd like to take a minute to acknowledge and thank some very important leaders. Dr. Walker, Dr. Brain, Dr. Wilson, Dr. Benger, Dr. Meyer, and Dr. Foley have brought allogeneic, autologous, and now CAR T-cell therapy to Hamilton as pioneers, and we're so excited to have that history. I'd also like to thank the fantastic multidisciplinary healthcare team for providing care for transplant patients over the years and helping us to advance the science. The foundation that this team has built allows us to be here today. The opening of this unit was possible because of a lot of tireless work and dedication from some very special individuals. I'd like to thank Pearl, CEO of the foundation, as well as Charles, board chair, for their tremendous leadership throughout this campaign. A special thanks to the campaign cabinet for all of their support and contributions. I'd also like to thank Tamara and Aaron and the marketing communications team for all the work they've done for this project, including sharing those inspiring patient stories. I'd also like to thank the administration who's been supportive of this the entire way through. And thank you to the entire team who has been contributing to the development of the new unit in all ways. It's because of all of your hard work that our dream has now become a reality. This new unit will allow our specialized team to provide the best care possible to our transplant patients in a state-of-the-art facility. The future is really promising. This new unit will facilitate research that will allow us to make transplant safer and more effective, by allowing us to better prevent and treat complications of transplants. It'll also allow us to continue to provide innovative treatments, for example, using cellular therapy to treat even more diseases. And finally, it'll allow us to help train healthcare providers and researchers to become future experts and leaders in stem cell transplant and cellular therapy. We're really excited to get started. And if you'll join me, I'd like you to come and join me for a virtual tour right now. I'm Dr. Kylie Lepik, the Medical Director of the Cellular Therapy and Transplant Unit here at the Jurabinsky Hospital and Cancer Center. And I'm pleased to welcome you to the new wing here for hematology patients, the Ron and Nancy Clark Stem Cell Transplantation and Cellular Therapies Unit. We're located here on the 4th floor of the Jurabinsky Hospital and Cancer Center, and we're very excited to open our doors to patients. This unit is here to service hematology patients, particularly patients with disorders such as leukemia, lymphoma, and multiple myeloma, as well as other important diseases of the blood and marrow. Here we are in one of the patient rooms here in the new unit. When this new unit was designed, it included the input from many different people, and that really was a goal to make it as patient-friendly for families and patients as possible, as well as extremely functional. And we relied on many sources, particularly the Patient and Family Advisory Committee, or PFAC, to give us some very important insights into how to make the room the best it could be for patients and their families. Our PFAC representative gave us ideas about the layout of the room, in terms of even how the door opens and how a patient will be needing to move throughout the room so they have no barriers or obstacles to allow them to get where they need to be in the room when they're not feeling at their best. You can see that each patient room has a very large window, and that's important because patients here, when they undergo stem cell transplant, their length of stay in the hospital can be up to 4 to 6 weeks. And so we're trying to make that time here as comfortable as possible. The rooms here on the unit are specially equipped with state-of-the-art equipment, including something as simple as a sink here in the patient room, which is important obviously for hygiene and patient's daily use, but is actually used as well with special temperature control to help us thaw the stem cells, which are actually frozen for many types of stem cell transplant. Each patient room is equipped with its own washroom, and that's important for infection protection purposes for patients undergoing stem cell transplant. It's also great for privacy, and so each washroom, of course, also has a shower right in the room, a very spacious washroom as well, without any barriers or obstacles. The rooms have positive pressure ventilation, and that's a very important airflow that is necessary for patients undergoing stem cell transplant. Patients undergoing stem cell transplant are at risk of infection because of lower or compromised immune systems due to the disease, as well as the treatment while they're waiting to recover. So it's very important that the airflow in these rooms pushes air out. So we're pushing out any possible contaminants or pushing out any risk of infection from entering these specialized rooms. And that is unique to each of these rooms here on the unit, as well as the unit itself, which has that important positive pressure ventilation that we call it. Also, you'll notice as we walk throughout the unit, the different color scheme. Indigenous consultation was sought to make sure we have the best colors for the healing environment that we were looking for these patients. More specifically, you'll notice the colors are representing Mother Earth and sky, as these are felt to have healing properties and create a healing environment, which is important for patients and their families as they go through this challenging process. And here we have a patient consult room. So this is a space where patients and their families can meet with their healthcare team, and we have 2 such wonderful rooms here on the new unit. Here we have the nursing station, where a lot of the important action happens from our healthcare team. Here in the unit, one very important part, especially today, is where we store our personal protective equipment. And here we have one of our meeting rooms. We need to have a very specialized team of individuals to care for these patients. The physicians, the nurse practitioners, their nurses, allied health. The new unit is equipped with 2 family rooms. These areas are places where families and visitors can relax in a lounge while their loved ones are undergoing these procedures. Behind me is Oncology Day Services. Finishing up its final stages of construction is an expansion to our ODS. This expansion will include increased area for apheresis, which is the procedure where stem cells are actually collected. It also includes new patient assessment areas for scheduled and unscheduled or urgent care, as well as treatment bays where patients can receive things like transfusions and other important therapies and medications. The expansion also has included an increase to our pharmacy, which is very important because this is where some of the specialized medications are prepared. And it is now furnished with the latest technology, that'll help with dispensing as well as compounding or mixing these important specialized medications. The new unit here at the Juravinski Hospital will allow us to meet the ongoing increased need for stem cell transplant and cellular therapy for patients regionally as well as provincially. But not only that, it'll help us to expand our hematology program in terms of education of new hematologists and fellows, nurse practitioner, nurses, and allied health. It also will allow us to expand our research mission to make sure more patients can be a part or opportunity to participate in clinical trials and other studies that help advance the science behind stem cell transplant and cellular therapy. In addition to the 15-bed unit you see here, an expansion to pharmacy and oncology day services, there's also been an expansion to the clinic rooms called Clinic F at the Juravinski Cancer Center, where patients are seen for their outpatient visits. Also, there's an expansion to the stem cell lab, which includes increased area for more freezer space, as for many patients undergoing stem cell transplant, their stem cells are actually frozen to protect them until they're ready for the patient to receive them. Thank you to all the donors who helped make the stem cell unit a reality. Thanks for making a vital difference.
Hi, my name is Frank Tusaw, and I'm pleased to talk to you a bit about the new stem cell unit at Juravinski and the expanded cancer services. As a cancer survivor, I know firsthand what this means to cancer patients. You see, I was diagnosed with double-hit lymphoma. I underwent 84 chemo treatments and spent 82 days in this hospital. The last part of my treatment was a stem cell transplant. I owe my life to this amazing treatment and to the supportive care of my wife, my 4 daughters, family, friends, and the incredible nurses, doctors, and staff here at Juravinski. Following my treatment, I was looking for a way to give back. I applied for and was selected to join the Juravinski Patient and Family Advisory Council. Through this committee, I have been involved in a number of initiatives, including advising the design team on the layout of this new expansion. I took into account my patient experiences at Juravinski. So to have rooms that are bright and airy with outside light and also areas for families to come when they visit is a godsend for these patients. So on behalf of all patients, I thank you for your generous support.
Thank you, Kylie, for sharing the virtual tour. Your tour went very smoothly, and I appreciate all of the assistance for our comms people downtown and the sense of humor folks have to have as we try and navigate Zoom and virtual celebrations. It would be fun to do this face-to-face, but we're really appreciative that we can do this today. So thanks for bearing with us, and I hope you had some smiles with that, and we're able to appreciate how fantastic the new unit is. I also want to thank Frank Tusaw, who's been just an extraordinary member of our Cancer Program Patient and Family Advisory Council. Frank joined the council, I think it was 2014, might have been 2015, and he provides really wise counsel and has stepped up in many specifics to assist us along the way, including his commitment to the development of this campaign. As you can see, the new unit is really impressive, and I want to thank everyone who has had a role in its creation. Many have been thanked along the way. I want to mention Kelly Campbell and Teresa Reynolds and the team from Capital who did exceptional work in getting us to where we are, and also want to thank Kim Alvarado, who is the director within the oncology program, for her leadership in bringing together staff, physicians from the hematology program, from the laboratory, from the pharmacy, all for a coordinated planning process to develop the build of the unit, but also its operations. Today's a result of the hard work of many, many people, and leading for a place for innovation and a leading care for our region and, in fact, for the entire province. I'd like to thank everyone for attending today. I hope you can see why we're so proud of this new unit, and we appreciate all the support folks have provided for this. This will bring a close to today's celebration. I hope folks have a great weekend. Thank you for joining us.